So I acknowledge that we meet on Aboriginal and Torres Strait Islander land. I pay my respects to elders past and present, acknowledge that sovereignty hasn't been ceded, and extend my respect to any Aboriginal and Torres Strait Islander people here today. I'm joining from Wurundjeri country, which is part of the Kulin Nation, and acknowledging that we're all joining from different country across Australia. And if you'd like to drop your country in the chat and where you're joining from, you're welcome. In terms of housekeeping for this event, we have closed captions on with the automatic Zoom set up, so you're welcome to turn that on if you'd like to follow captions. And we're going to have a number of different speakers and then questions towards the end. So if you have any questions, you're welcome to put them in the chat and I'll note them down and facilitate them at the end, or you can wait till the end and ask them. The event itself is about a new project that we're undertaking at the Australian Women's Health Network. So recently we've secured 3 years of funding. It's under the Australian Government Department of Health Peak and Advisory Bodies Program. The funding came alongside the publication of the National Preventative Health Strategy 2021 to 2030. This will support us to continue our work to develop gender-informed primary prevention with an equity lens, and will support the renewal of the Women's Health Hub. But first, before we go any further, we've got a message from Assistant Minister for Health and Aged Care, Jed Kearney.
Well, hello, and thank you to Bonnie Corbin, Chair of the Australian Women's Health Network, for inviting me to speak today. Before I begin, I want to acknowledge the traditional owners of the lands on which we meet and pay my respects to elders past, present and emerging. I join you today from Parliament House in Canberra on Ngunnawal country, and I would like to acknowledge the traditional owners of the land where I am. I extend that respect to other First Nations people joining this summit. I'm proud to be part of the government that is committed to the Uluru Statement from the Heart in full. I'd like to begin by congratulating the Australian Women's Health Network for their many decades of work driving change in the pursuit of women's health equity. The network does such important work bringing together organisations and consumers to have a voice. You're incredible advocates for the women's health, and I'd like to thank you for being here today. And I'd also like to thank the network for providing that national voice, which is integral for all of us to achieve greater collective action on women's health. It's a pleasure to be invited to launch the Women's Health Hub co-design strategy. We all know there are differences in health outcomes between the sexes, and more often than not, it is women who experience poorer outcomes. And it is thanks to work like yours that we can change that and put women's empowerment in health front and centre. I look forward to hearing the outcomes of the engagement process as the co-design strategy is carried out. Women's health equity is an issue that is particularly close to my heart. Some of you will know that before becoming a Member of Parliament, my background was in nursing and the union movement. I was a nurse for 20 years and worked at the Austin Hospital in Melbourne in various roles. I ended my nursing work as a Director of Clinical Nursing Education. I was also Federal Secretary of the Australian Nursing Federation before becoming President of the ACTU. I'm actually really proud of my work as a nurse and in advocacy over many years. Now in my new role, I've been given particular responsibility for areas where access and equity to healthcare have been found wanting. I'll be working across population and preventative healthcare, so with the LGBTIQ community, with migrants and refugees, people with disability, and an area I'm incredibly passionate about, as I know you are, women's health. I'll be working through this term on ensuring women have the equitable access they deserve to healthcare, and on addressing the significant biases that exist in healthcare on the basis of sex. This includes women not being believed or discounted when they present with symptoms like pain, or being misdiagnosed and underdiagnosed and undiagnosed, being over and underdosed with prescription drugs, not being represented in clinical trials and research, and in bearing the stigma attached to so many women's health conditions, like those associated with menopause. Australian women, girls and gender diverse people, especially those at greater risk of poor health, deserve equal access to safe, effective, affordable and appropriate healthcare services and supports that are tailored to their circumstances. I'm committed to working towards better health and well-being for all women, no matter what stage of life they're in, where they live or their cultural background. Recently, I've been focusing on the lack of access to sexual and reproductive health information, treatment, and services that empower and support women to have choice and control in decision-making about their bodies. Right now, there is a national inquiry into sexual and reproductive health before the Senate, and I look forward to hearing its findings. Being a federation, this can bring particular challenges, but we will work alongside state and territory governments to ensure women have greater access to reproductive health care when they need it. The government is set to deliver a national strategy to achieve gender equality. We want Australia to be a global leader in gender equality because sadly we have regressed on the global scale. The strategy will set out concrete actions that focus on a number of the social determinants for women's health, including economic equality and independence, leadership, representation and rights, and balancing family and care responsibilities. We are a rich and diverse country. No individual or group needs fall under the radar when it comes to safe, quality and affordable healthcare. So thank you again for inviting me to speak with you today, and thanks to you all for the tireless work you do every day to improve women's health in the country. I look forward to hearing more about the consultation process to update the Women's Health Hub and the results of this important and very necessary work. Thank you.
Thank you, Assistant Minister, and thanks, Shanna, for playing the recording. I think it's really timely to have these conversations about anti-discrimination in health, and particularly useful how we bring in human rights approaches, and look forward to how this project can feed into some of those areas that Jed mentioned in her speech. And so next we're going to segue on to Professor Helen Kelleher to speak about a history of the Women's Health Hub and provide an overview of the Health Peak Advisory Bodies project. Thanks, Helen.
Thanks very much, Bonnie. And how refreshing is it to have a Minister for Health who's a woman and takes such a keen interest. It's also wonderful to have the energy of a bit of funding. It's not a lot of funding for the Australian Women's Health Network, but the status of being a Health Peak Advisory Body is also just so exciting for us. And it's a status that we really want to build on. The thinking that was in our minds was that in 2020-21, the National Preventive Health Strategy was launched, as you'd be aware, and it has some quite good priorities: reducing tobacco use, healthy diets, physical activity, if you think that's really going to change a lot of health stuff, cancer screening and prevention, immunisation coverage, alcohol and other drug harm, promoting and protecting mental health. But none of it's gendered. And we know that there are significant differences across all genders in those issues. And we felt that there was a real opportunity for us to take the women's health strategy, A, strengthen it, and B, put the gender lens of women's health across the National Preventive Health Strategy. And that was the essence of our application, our submission, which, as you know, was successful. So we wrote into that a refresh of the Women's Health Hub, which I think has been quite appealing, actually, in the overall submission, in that it will be a centralised resource. I can't remember, Marilyn, how long ago the first Health Hub was delivered. Do you recall what year that started?
Sorry, no, but it'd be easily 15.
Yeah. Mm. And because we haven't had the kind of money we've needed to refresh the website and the technical kind of aspects of the hub, this is really refreshing for us now to have funding to do that. So the Women's Health Hub will become a fantastic resource. We've undertaken to develop policies and position papers on the priority areas. We've also joined in a partnership with an MOU, hello Leslie, with the Women's Health Translation Network. You might know of Leslie's work, and Deb Loxton, who's also part of the Australian Longitudinal Study on Women's Health, and a whole bunch of other she has launched our co-development fantastic strategy. So I'm going to hand over to Shanna to explain a bit more about that.
So thanks so much for for joining this this event today to learn and I guess especially launch the co-development strategy for refreshing the Women's Health Hub. For those of you who I haven't met yet, my name is Shanna Aguilar. My pronouns are she, her, and I'm joining you from the lands of the Gubbi Gubbi and Kabi Kabi people in Southeast Queensland. And yeah, I'm really here to share a little bit about the project that is building on the work of people within this room, AWHN's membership across the years. And I think it's quite exciting over time that we can build on something that is potentially has been around for 15 years and really look at what is needed and what will really serve women's health across Australia. So on that note, yeah, just wanted to start by asking, you know, what does work well to support women's health in our communities, and how can we shift the way that we understand prevention when it comes to women's health in all the diversity, communities, and contexts across Australia? And how can prevention strategies more effectively integrate with the broader ecosystem of health policy and programs? So really, the aim of this project is a national online initiative to really define and explore what effective prevention looks like across different thematic areas of women's health and populations from a gender equity lens. Doing what AWHN does best in terms of developing women's health policy and resources that is responsive to identified areas of need. And really being able to bank the wealth of knowledge and expertise, and that will continue to emerge into a refreshed women's health hub. And by doing so, be able to share that emerging evidence through online education and training, recognizing that, you know, post-COVID or in navigating a COVID context, that we are doing a lot of this stuff online, and it also brings with it opportunities to be able to reach people across Australia, which AWHN has done for many, many years. And as mentioned, that it has been funded under the Health Peak Advisory Program, recognising AWHN's role as a national collective voice on women's health. So in terms of the resources and what eventually gets developed out of this project, we really want to be able to support health advocates, practitioners, governments, and those who have a stake to strengthen and ensure women's health is properly resource funded and really focuses on prevention as well. And others who have that commitment to improving women's health outcomes really have these resources that'll be on the Women's Health Hub, supporting us all to embed a gender equity lens throughout our prevention work. As has been mentioned, we've got the 2 national strategies, and so this project will also align with what's in these 2 strategies alongside the commitment that AWHN has to the determinants of health. And I have popped a couple of links to those in the chat as well. In terms of the project specifically and how it relates to the Health Peak Advisory Bodies program and AWHN's mission, it's really designed to increase that evidence-based knowledge about effective prevention from a gender equity lens. So how can we embed that gender equity lens across those strategies? How can we strengthen national advocacy and help our members drive that advocacy across those levels of state, regional, rural, and national levels, recognizing that there is, AWHN has a long history of really passionate members across Australia. So how can this project really support that in a time where we do have resourcing, and how can we really make sure that the Women's Hub is a hub to support you to do the work that you do every day? Of course, being a health peak body and advisory group, providing well-informed and impartial advice to the Commonwealth, and also that capacity building piece of providing education and training resources so that we can improve the quality of health services as a whole. In terms of ways to get involved or where the opportunities lie as we co-develop this project, I've just got a diagram here of 3 sort of loosely based stages of the project as it's a 3-year project. So the first stage in this current financial year is around mapping. So making sure that we're engaging key stakeholders, building on what's already been done. So what existing content do we have that we can build on? How can we engage and make sure that our First Nations engagement is really robust? So doing that work and taking that time, and also doing a lot of, I guess, pulling together the expertise across online sessions, workshops, and surveys, and also the user experience planning. So what will a robust, useful, valuable Women's Health Hub look like? Stage 2 will be looking at the development of those publications, resources, the policy papers that AWHN is known for, but also what works well. So how can we draw on what works well across our membership and across those that we work alongside, developing some of those stories, and as well as developing the hub and testing the user experience of the hub as well. And of course, with any project, we want to make sure that we are checking in on how well we're going. So embedding project evaluation through the process too. And then finally, understanding this won't be a linear process, but we do have a robust foundations to build on. The idea is that by towards the end of the 3 years of this project, that we'll be able to share. So that we'll be able to have published and launched the hub itself and the training resources and mechanisms, looking at monitoring and evaluation in terms of those training packages. What does effective gender informed and prevention from a gender equity lens look like, and how can we measure that? And calling on the members and our partners and key contributors to promote and share that emerging knowledge and practice, so that the people who need to embed a gender equity lens have the resources at hand, and we can work alongside each other to improve women's health outcomes over the long term. In terms of who we're engaging throughout this process, probably doesn't come as much of a surprise, but obviously our AWHN members who sit alongside many different aspects and contexts of the health system. So I've popped in here, the health consumers and communities that have been mentioned, really being able to draw on the consumer networks across our members as well, recognizing that on a practical scale and on a national level, how can we really make the most of our membership and consumer networks to ensure that this process is something that meets the needs of those people that we work with. So across services, working alongside other health peaks, the colleges and industry bodies, different levels of government, and of course, think tanks and academic institutions, and gender equity and other organizations committed to this work as well. And just finally, I wanted to note the project principles and basically our approach at a higher level of what's going to guide and keep us accountable, and hope that our members keep us accountable as well. I won't touch on all of them today because we'll pop in a link to the co-development strategy for you to have more of a read. But definitely coming from a gender and equity lens, the population approaches and social model of health, I thought was particularly important to touch on, because we recognize that any strategies have to be informed by the diverse experiences of women. And so this project will look to explore what works well to improve health outcomes and increase health equity for all women, so including Aboriginal and Torres Strait Islander women, migrant and refugee women, women with disability, and also LGBTIQ people. And I think really recognizing that rather than reducing women's health to our bits and parts of our bodies, really looking at the social aspects and social determinants. Because if we want to prevent ill health and move towards actually what does health mean for women in our communities, we really need to look at that whole picture at a broader systems level. So to finish on, I just wanted to ask you what works well in your contexts, in your places, locally, regionally, nationally. We're going to be looking to collect some stories over the next couple of years as well. And for example, one of our members in WA, and thank you to Megan, who also supported as our WA board member to help us collect some of these stories. So we'll pop a link in the chat for a video that they've shared around some of the things that they've been doing throughout COVID as well. And I also wanted to acknowledge that this that this work and sort of the foundational strategy for this project has been informed by some of our critical friends who are also on the line, but including AWHN, Women with Disabilities Australia, and also Multicultural Centre for Women's Health, in recognition that this is work that we can't do alone, and that we really need to work alongside our members to find out what works well in your context and share that knowledge accordingly.
So thanks for your time today, and we look forward to seeing you soon.